Okay, we are almost there.
Can everyone see my screen?
Yes, we can.
Okay, I'll put it into presentation mode now.
Fantastic. Okay. All right. Are we on presentation mode? I think so, right?
Yeah.
Teixeira?
Yeah, we are.
Great.
Yeah.
Fantastic. Okay, so let's officially kick off this webinar session. And let's start with a quick introduction from my side. So first of all, welcome everybody. My name is Gian Meloni. I am a research officer at the Sanitation Learning Hub at the Institute of Development Studies. This is a webinar series on sanitation and hygiene throughout and beyond the COVID-19 pandemic, hosted by the Sanitation Learning Hub and UNICEF. I am facilitating this webinar with the support of my colleague Teixeira Briggs Graham. Next, please. The Sanitation Learning Hub is a research and learning program that provides practical support to sanitation practitioners, policymakers, and decision makers, develops current thinking about inclusive sanitation and participatory approaches and research, and creates space for sharing and learning in the sanitation sector, which is what we are doing with this webinar series. Next slide. Next slide, please. Thank you. So just a couple of words on this webinar series. So this series of 2 webinars is about sanitation and hygiene throughout and beyond the COVID-19 pandemic. In short, we are trying to reflect and find answers to the question on how to keep working towards long-term sanitation objectives during the pandemic. So not much about short-term responses, but about continuity of sanitation and hygiene services throughout the pandemic and what this will look like in a post-pandemic future. So we are going to talk about successes and setbacks and adaptations and what we have learned in this period and what this implies in our ways of planning, implementing, and monitoring sanitation and hygiene now and in a post-pandemic future. Today's webinar is about working with government and utilities, while the second webinar, which would be in exactly 2 weeks from now on 31st August, is going to be about sanitation, hygiene, and the new normal. Next slide, please. Now let's take a second before jumping into the contents to do a little bit of housekeeping. So you will see at the bottom of your screen, there is a Q&A button that you can use to ask questions to the panelists and to the speakers. You can ask questions by showing your name or anonymously, depending on what you prefer, to a specific speaker or to all of them, and I will facilitate this process. You can also see a chat box that some of you have already started using. That is to introduce yourself, to let us know what you do, who you are, if you wish so. But please, for questions, use the Q&A box. Also, during the webinar, we are launching 2 polls. So please stay tuned because your answers are very important and valued. And at the end of the session, as soon as we close the session, you will be asked to fill a survey, which will give you the opportunity to let us know your feedbacks, and you are very much invited to do so. Now, next slide, please. Next slide, please.
Sorry, it's just been quite slow at the moment.
Okay, well, in the meantime, let me give you a brief introduction to today's session, which is about working with governments and utilities throughout the pandemic. We have some great speakers and panelists who are Effie Akinyi from Sanivation in Kenya, with her colleague Nandita Kotwal, who's going to join us a bit later. We have UNICEF India, and they are represented by Shweta Patnaik and Sujoy Mujumdar. And Gather Madagascar with Nicola Radanielin and John Peter Archer. The first part of the webinar is made up of these 3 presentations. After each of those presentations, there will be a few minutes for questions and answers about those presentations. However, the bulk of the conversation is going to take place in the second half of the webinar, where we are going to use aspects that emerge from the presentations and from the questions to start a broader debate about the implications of the things discussed in the examples presented on sanitation and hygiene in this moment during the COVID pandemic and in a post-pandemic future. And the second part of the webinar, the debate part, also in this section of the webinar, you are very much welcome to keep asking your questions and engage with the speakers and panelists. And I will do my best as a facilitator to make this go smoothly. I think this is all we needed to say for now. So in the meantime that our first speaker, Effie from Sanivation, gets ready, can you, Teixeira, please launch the first poll for today? Great. So we are keeping this poll open for just a few seconds because it is quite simple. So you will see that the poll is made up of 3 questions. The first question is about where you are based. The second question is about the kind of organization you work for. And the third question is about your gender. Please keep in mind that your answers are anonymous. So what we see here is the aggregated answers, and they are not associated to your names. And yeah, so let's wait another bit, and after that we'll be able to end the poll and share the results. We see that some questions are still some answers are still coming in. Let's see if there are more answers coming in. Doesn't seem so. So Teixeira, can you please end the poll and share it with everybody? I hope everybody can see the results. So we see that most of the participants are from Asia and from Sub-Saharan Africa, which is a good split, and also a significant chunk is from Europe and North America, and these are, but I would say that Central Asia, Southern Asia, and Sub-Saharan Africa are the most represented regions of the world. And in terms of kind of organizations, there is a significant representation of national or international NGOs, United Nations, and also academia, education and research, but also we have national governments, utility service providers, independents, and so on. And we can see also that we have a pretty good gender balance with an almost 50-50 representation. Okay, so now without further ado, I think we can stop sharing the results, Shada, and we can move on to our first speaker. Our first speaker, who is Effie from Sanivation, Kenya. So can we see the presentation? And Effie, are you ready to start?
Yeah, I can.
Okay. All right, the floor is yours.
Yeah, so hi everyone, thanks for joining. My name is Effie Akinyi. I'm the project development lead at Sanivation. Sanivation is a social enterprise that partners with local government to deliver on sustainable citywide infrastructure. We are currently based in Kenya. So today I'm going to share our lessons with working with utilities in delivering sanitation services during this COVID situation. Next slide, please. Yeah, so talking about sanitation challenges. So you realize that broadly, some of the existing challenges in sanitation really make it difficult to provide a lot of sanitation services. One of the challenges being inappropriate infrastructure. A lot of wastewater treatment plants currently are inoperational due to the bad maintenance. A study that was conducted by WaterAid indicated that 95% and 80% of wastewater treatment plants in Mexico and Ghana are currently not operating. And another challenge is on cost. You realize that most of the traditional services can cost more than $20 per household per month because provision and payments for toilets and investment in toilets and sewers is quite expensive to the household. And another challenge is on informal settlements characteristics. Due to the high urbanizing and upcoming peri-urban setups, there is need for more sanitation solutions that is not combines a majority of models to make sure that no one is left behind. And sanitation being a complex issue and requires a lot of collaboration with different stakeholders, there's really a lot of role overlap to make sure that they're able to deliver well. And there is really lack of clarity in mandates when it comes to delivery of these services. And lastly is on capacity. There's really low technical capacity following health and safety guidelines, and lack of clear understandings from the community on hygiene practices. And more so, just to add on to that, here in Kenya, most water utilities have mostly been delivering on water mandates. It's just up to recently that WASFREB is encouraging them to adopt sanitation aspects. So we see a lot of gap capacity in terms of delivery of the sanitation services. Next slide. Yeah, so now that COVID is here, the situation really worsened. So like in terms of appropriateness on lack of appropriate infrastructure, there is potential increase in open defecation, where you see landlords cannot be able to pay for improved toilets and make investment on emptying infrastructure. And a lot of utilities currently are cash trapped and are not able to pay for treatment infrastructure. So for informal settlements, we have a lot of shared sanitation facilities. So during the pandemic, the population, especially in the low-income communities, is highly dependent on community hand washing stations and shared toilets for their sanitation needs. and most residents of informal settlements really share these toilets. So for instance, in Naivasha, we conducted a study and found out that 75% of households share a toilet, and up to 50 people really share that single toilet. And we all know that shared sanitation points and water, such as public toilets and water taps, have high potentials and cause for infections across the community. The challenge on technical capacity, there's really low technical capacity to deal with additional service provision and emergencies. The communities lack training and basic supplies for proper hygiene, and essential workers also lack health and safety training. On cost, populations really cannot be able to pay for services due to economic losses, putting a lot of strains on cash-strapped utilities. So the Kenya National Bureau of Statistics recently conducted a study, and nationally 37% were not able to pay their rent, but for the households that they were able to talk to, 67% ideally were not actually able to pay their rent because of the COVID impacts on economic losses to them. Next slide. Yeah, so as a company, Sanivation, we really make it easy. We support secondary cities to deliver on their sanitation mandate, even during this pandemic. So we do it in 3 stages. One, we design and develop citywide inclusive sanitation plans. We design feasibility studies. We do market assessments, capacity building, and engage a lot of stakeholders in workshop, a roundtable where we can ideally discuss and understand what really is the challenge and what are some of the solutions to be able to enable them deliver on sanitation mandates. And we also adapt and expand by optioneering for sanitation solutions and see what works where. It's not a one solution, but sanitation really needs a blend of solution to make sure no one is left behind. And then finally, we build and operate operationally sustainable waste to value treatment plants. We do waste collection services and also provide container-based sanitation services. Next slide. Yeah, so as a company, what we did when COVID came in, we still continue to operate our waste to value plant with limited capacity. We had to install a lot of hand washing stations and encourage people to sanitize in our treatment site. We had to introduce a lot of COVID messaging for staff. We had to reduce the number of staff and introduce different shifts to reduce overlap of personnel, and also encourage work from home, and had to close our HQ office. And because some of our customers, we sell solid fuels that targets mostly industrial commercial setups. And so when COVID came, most of the schools were closed, hotels were also closed. And those being our key customers had an impact on our sales. And so we really sold fewer briquettes to the hospitality industry. Next slide. Yeah, so an experience with working with the utility. So just from the statistics that have shared, the challenge with access to toilet facilities, we've been working closely with the Center for Disease Control to make sure that the people who cannot pay and the informal settlements who cannot really afford to pay to access these toilets, we have done additional construction of shared sanitation facilities. But on top of that, working with the utilities, it has not really been a smooth run for them. They've experienced quite a number of challenges with the COVID situation. For instance, they've also experienced reduced emptying frequencies. So we've been working with the Naivasha Water and Kisumu Water, and they've been providing this sanitation services in terms of emptying. So with the introduction of curfew, the government introduced some strict measures like curfew. As much as they are the essential workers, there was that panic and all that. And customers not able to afford to go for these emptying services, these ones were significantly reduced on them because most people really prioritized on food. And then they had to really make investment on provision of hand washing stations and soaps, and also did a lot of training of community-based organizations that are providing water to the community, and of course on safety and behavior change. They also had to minimize a lot of customer engagement because the government here in Kenya banned all meetings, and so they had to reduce or rather minimize that. One of financial implication to the utilities, for instance, there was a significant reduction on revenue. So for instance, Kisumu Water mentioned that their revenue reduced from 70 million to 52 million, and the collection efficiency also went down. They also had to deal with demand versus supply of water to the customers. Yeah, and I think also on human capital with the COVID situation, they also mentioned that this created a lot of pressure and stress to their staff, and this one really affected their ability to really work properly because most of them were working in panic mode. So these are some of the challenges that the utilities have really been going through. Yeah, next slide.
Sorry, Effie, just to be time aware, can you wrap up in a minute or so?
Yeah, definitely. Yeah, I'm wrapping up. Yeah, so a couple of things that we've done together. Most of the utilities have developed business continuity plans. They have had to reorganize their budgets to really meet these emergency services. Most have established a call center to make sure that all customer complaints have been addressed. And we are currently working with them to develop an emergency preparedness plan to make sure that they are well prepared, their coordination mechanism is up to speed. And of course, they also had to reshuffle a lot of their vulnerable staff that they see might be exposed. Next slide. Yeah, so COVID has also come with a lot of positivity. Like for instance, in Naivasha, we've seen a positive in terms of diarrheal cases. Most mentioned that there's significant reduction in terms of diarrhea and a lot of collaboration with other stakeholders when it comes to wash committees to make sure they're able to curb this situation. Yeah, next slide. Yeah, this is some of the ongoing work that I think I've mentioned, making sure we develop a plan together. We provide technical capacity. We do a lot of behavior change and sensitization and making sure that they have the right budget code that is embedded within their business and strategic plan. Yeah, that's all from our end. Yeah.
Thank you very much, Effie. It was a very interesting presentation, and I think a lot of challenges and responses were highlighted. Before we open the floor to any questions, I see that some of the participants are asking if the presentation, if the slides are going to be shared afterwards. And on that, I am not completely sure, to be honest, but we can do our best to make that happen. My invitation is really to make the most of the live session now that we have the speakers at our disposal to ask all the questions that we would like to have answered. So is there any question for Effie about the sanitation work of Sanivation in Kenya, especially in the Naivasha area? For instance, if there is no question for now, I may ask one. So if you can just tell us very quickly in a minute a bit more about the emergency response plans that you have mentioned with the sanitation utilities?
Nandita, I'll take that. I see Nandita's joined. Yeah.
Go ahead, Effie. You can take that if you want to.
Yeah, so for the emergency preparedness plan, you realize that at the moment in the business and strategic plan for the utility, they did not include anything on emergency response. So making sure that they have a clear checklist of what needs to be done during an emergency, what are the coordinating mechanism, what kind of investment needs to be there, what are some of the budget costs they need to include in their plan, who are the key pointers or key stakeholders that they quickly need to reach to, and with clear roles and responsibility in case of an emergency. So it's basically all these things marbled together to make sure that they're very much ready when an emergency actually happens, and they have a clear budget set aside to make sure they're able to handle such.
Yeah, and just to add to what Effie said, I think we've really been focusing on trying to integrate some of this emergency planning into their business planning, so that when something happens, it's not that there is a separate emergency plan which no one looks at. So integrating it into existing master planning or business continuity plans, as we've seen for Kisumu and Naivasha, that's something we're really trying to do with the utility.
Thank you. In the meantime, more questions are coming in. Actually, a lot of questions. We are not going to be able to answer all of them, but just to pick some of them. And once again, there will be time to expand on all these points later on in the second part of the webinar. Let me just pick a question about this. For instance, there's a question about what kind of utilities Sanivation works with and what kind of arrangements, for instance, memorandums of understanding you have with them. And another quick question is whether there has been an increase in demand for container-based sanitation solutions in this period. I don't know if Nandita or Effie would like to answer this.
Yeah, I'll answer the first, Nandita can take the second. So currently we work with water service providers here in Kenya. That's one of our target customers. And we currently have a joint development agreements with them, which clearly defines what our engagement will be moving forward. So yeah, that's currently the engagement we have, and it's mostly with the water service providers, in addition to the county government and other sanitation partners within the county or within the region. Yeah.
Thank you very much. And anything about container-based sanitation by any chance? It's a very specific question that we got about it.
I mean, Effie chip in, but to our knowledge, not specifically did we see any demand, but what I think we've seen demand is in improving current existing on-site systems. And this includes, like, we have some work in the north of the country where there's informal pit emptying. So there's a lot of emphasis mostly on formalizing some of these on-site systems. But specific to container-based sanitation, I mean, we haven't seen any specific demand from utilities or people, but we've also, to be very honest, not explored that or gone ahead and asked people if they want CBS. So I don't know if that answers your question, but I don't know if you have anything to add to that.
Yeah, thanks a lot for that. There are also more questions that are coming in, but I would actually discuss this more broadly in the second part of the webinar. For instance, there are questions about an important point about shared sanitation, for instance, also questions about capacity. These questions would be relevant, I think, for all the presentations and the panelists. So I am taking note of this. We are keeping those points in the parking lot to expand the debate in the second half of the webinar, if it is okay for everybody. For now, I think that we can say thank you very much to Effie and Nandita. Please stay with us. There will be more opportunity for you to input. And I would leave the floor to the second presenter, who is Shweta Patnaik from UNICEF in India.
Thank you, John, and good afternoon, everyone. I am presenting this on behalf of UNICEF India, along with my colleague Sujoy Majumdar, who is here. Our work is on strengthening Panchayati Raj institutions for water sanitation in India. And Panchayati Raj institutions are the smallest unit of local self-government in India, who are democratically and constitutionally elected every 5 years for a village or for a cluster of villages, which are called Gram Panchayats. Next slide, please. So this is the structure of our presentation. We would be speaking about during the pandemic, what is it that UNICEF did with empowering Panchayati Raj institutions to deliver on sanitation, and how the challenges of COVID-19 impacted our regular programming, and we had to re-strategize to address that along with COVID response. Next slide, please. As I already mentioned, so this was envisaged by the father of the nation, this particular structure of local self-governance by Mahatma Gandhi. And it was a vision where it was hoped that the villages in India and the cluster of villages would address their own programs, lead it, and also be leaders of financial powers and programming. And especially with sanitation, these Panchayati Raj institutions were assigned with the responsibility for water and sanitation at village level, or the cluster of villages that come there. They were also given powers to take their own decisions and implement the program, as well as at the drawing and disbursing officers for the funds that came in. And more specifically, the Indian, the finance commissions, I'm sorry, this become financial, the finance commissions, they devolve these funds, centrally collected taxes, to states and local bodies. And these institutions get a very high amount of funding. 60% of that in the last year and this year has been allocated for drinking water sanitation. So that sums up to around 5.5 billion US dollars every year to about 255,000 panchayats or units that are there in India. Next slide. And so this was the key issues that UNICEF and its partners had to work on in the different states at national level and at the states, and why we chose to work with the Panchayati Raj institutions vis-a-vis sanitation. Like we mentioned, they had the responsibility to deliver on sanitation and water like other subjects. Second, they had capacity issues and other structural issues that UNICEF was best placed to address with the national government and the state governments. So the 5 issues that we looked at are their roles and their enabling environment at national level and state level. What has financing got to do with it? And the amount of funding was quite huge, but they needed to be supported with capacities, plans to spend that finance, and also to implement programs. Communication skills, both for basic sanitation as well as the upgraded sanitation under the second version, the 2.0 or the Clean India mission. So beyond toilets, we were looking at sustaining sanitation as well as the ODF plus areas like solid and liquid waste management, operation maintenance, fecal sludge management. So those needed support and capacities, and then their support in managing and monitoring the same. Next slide. So more specifically, across those issues that we mentioned, these are specific interventions that UNICEF led at the national level, supported the national government, and also the specific state governments to empower and involve Panchayati Raj institutions in sanitation. So at the policy and national strategy level, UNICEF worked with Government of India and the Ministry of Drinking Water Sanitation then, and currently the Ministry of Jal Shakti, which has been restructured, worked on a 10 years sanitation strategy, and that included PRIs. They were a key factor in the 6 enabling factors that are there for taking forward sanitation. Secondly, the Swachh Bharat mission, second generation guidelines beyond toilet construction, going on to sustainable and sustainable use of them, and larger sanitation rules. Then the ODF plus roadmaps and inclusive sanitation guidelines, which UNICEF worked with the state. Coming to financing, like we mentioned earlier, the huge amount of funding for the sanitation program itself, as well as from the 15th Finance Commission funding, that needed the state as well as the PRIs needed support in breaking it down to small implementable plans supported by capacity as well as communication strategies. So that was supported. And then with capacity building, there was this unique program that UNICEF had introduced, which was called the Sujal and Swachh Gaon, which is water secure and sanitation secure villages, which these Panchayati Raj institutions were trained on in the 16 states that UNICEF supports. And there was a handbook that was prepared, and technology and designs in different states for disaster resilient toilets. So which can be, because many states are prone to flooding and vulnerable to flooding. So to ensure sustainability of use, these toilets were introduced and were being implemented by the state. And then the management and monitoring. So there was open defecation elimination plans, which were ideally 90 days plans for every PRI or Gram Panchayat institution, inclusive Gram Panchayat development plans, and ODF evaluation for 10 states that is just getting concluded. Next slide. Here we are talking about best practices. So we just shared about what was happening at national level. So with that in context, we were looking at 4 states in India, which were largely the eastern, western, and centrally located ones. So Odisha, where the Panchayati Raj institutions undertook periodic inspection to assess wash coverage. In Chhattisgarh, they had worked on solid and liquid waste management infrastructure and inclusive community toilets, which were made accessible for persons with disabilities and the third gender, which was very unique to the country, and also involved women self-help groups to manage these community toilets, waste collection, and monitor behavior change. Maharashtra, as this is where Panchayati Raj institutions used the 15th Finance Commission funds to facilitate convergence with other existing schemes and manage tariff collection and maintain the ODF status and waste disposal sites. In Gujarat, PRIs motivated people to adopt SLWM practices and promote O&M activities, including encouraging entrepreneurship with the local community. Next slide. John had specifically mentioned that we should highlight the COVID-19 sanitation challenges and speak more on this. So we had tried to prepare this in detail. So with the COVID-19 thing coming in, key issues that were seen was the safety of these panchayati Raj representatives or institutions, as well as the safety of the sanitation frontline workers that support them and are there at village level. And secondly, as far as infrastructure was concerned, the congregating near public tap stands or stand posts for water, or crowding in community sanitary complexes were not very supportive and was not really something that was needed in a situation like the pandemic was. So if you see the solutions that were tried for these above three, was that there was a lot of huge amount of communication funds for IEC, which is Information, Education and Communication, which were earmarked under the Swachh Bharat Mission or the Clean India Mission program of the government. And UNICEF worked with the government so that this funds can be actually diverted or reapportioned to getting safety kits, especially protective gear for this PRIs as well as the sanitation frontline workers. And also that same fund was used for disinfection at community level and for materials and solutions for hand hygiene. And this congregating near public stand posts, so that was addressed through this WASH IPC and addressing through hand washing supplies, ensuring that people maintained distance of those adequate distance before collecting water instead of all crowding near the water source, and massive support on behavior change campaigns. Doing that, there was out of a total of 255,000 PRIs, the programming here could reach almost 100,000 PRIs directly, who were also strengthened to monitor COVID appropriate behaviors and also programming during and throughout the COVID response. Other challenges that we saw during the COVID-19 were slowdown in retrofitting that was happening. So this retrofitting of toilets where special facilities or repair or stuff was there, and also for new access. So that slowed down. And so to address that, UNICEF worked with state governments to address the whole push on ODF plus, and so there was this award system that was declared during the pandemic on ODF plus communities, and states got awards for that, which also included COVID appropriate interventions and behavior. So schools were closed during the COVID pandemic, and health centers were overwhelmed. And so the protocol for school reopening and also for addressing WASH in health, where there was SOPs prepared to include WASH in all the overall institutional mechanisms, where PRI were at the forefront. Next slide. So coming.
Sorry. Yeah.
Last.
Once again, just a reminder about time. Please go ahead.
Thank you, John. Last slide. So so this is just the 4 states again. So if you can see these 4 states, you see the India map there, and the darkest color there with the state which is most hit, the western side, that is Maharashtra. So that was one of the states that was very badly hit, and also one of the states where the response to addressing the pandemic was also at its forefront, with very fast and capacities put in place with speed. There, a very unique intervention was planned, which was called My Family and My Responsibility Initiative campaign for PRIs, and in that from July 2020 to January 2021, it reached around 250,000 people in 250 gram panchayats, and a research said that 53% of the villages reported less than 5 cases during the second wave, and 80% of the villages had reported less than 5 deaths. So that was with that initiative in Maharashtra. In Gujarat, Panchayati Raj institutions managed, along with their sanitation programming, managed 14,000 COVID care centers and led the village COVID warrior task force in addition to sanitation and hygiene interventions. Odisha has a disaster management act which empowered all its 234 PRIs with administrative powers to which were equivalent to that of a district magistrate, and they led the COVID response in their GPs as per the Government of India guidance. Chhattisgarh, the PRIs led the WASH IPC, and along with the ODF plus protocols on solid waste management, they also looked at garbage collection mechanisms, disinfection drives, and declared the state. This was the state which had come out second in the whole country with the highest number of ODF plus gram panchayats. This is all from our side. Thank you.
Thank you so much. Thank you, Sweta, and the other colleagues who have contributed to this presentation. Let's take a few minutes for some quick questions and answers about this specific one, and then we are going to debate and discuss more in the second half of the webinar. I think there is already a question that that popped up during while you were speaking about CLTS triggering. Because CLTS triggering is based on community mobilization and community activities. So the question is probably about how you went about CLTS triggering during a situation of curfews, lockdowns, and social distancing. Can you please answer this one concisely? Thank you.
Thank you. So we were presenting here about the second part of the India sanitation program. So it's 2020 and 2021. So we did not use CLTS methods in this particular phase. We had gone on to the second level of sanitation programming. So our trainings massively worked on the Sujal and Swachh Gaon trainings that we had done for the PRIs that involved not in the community, but largely on messaging through mobile phones and through miking, which is actually a loudspeaker that is used on a moving vehicle, which reduced contact at the community level.
Can I come in with
yes,
Jan? Yeah, Shweta, so to answer the question in particular, I just want to point out that India used CLTS significantly between 2015 and 2019 when we were carrying out this ODF campaign. So most of the villages, the CLTS exercise were already covered. And in the state where Shweta is working, that was one of the states where CLTS was very successfully used to create ODF communities. So what I think Shweta presented was that part of it was done by 2019. And now we have gone a step beyond, trying to look at other activities like SLWM, solid liquid waste, and of course the COVID response. Over.
Thank you very much to Sweta and to Sujoy for the answers. There is another question here, and then we move on for now, but we keep all other questions in the parking lot, which is about ODF sustainability. And so the question is about how you, and I would translate that question as how to monitor ODF sustainability and how you manage to monitor the ODF status of communities during the COVID-19 pandemic.
So Joy, would you like to take that?
No, you take that first. I'll add on in case.
Okay.
Yeah.
Okay, so the ODF status, so there is a pre-agreed format or an indicators between Government of India and the states on where it is a weighted format or self-assessment, where each Panchayati Raj representative would self-assess and declare itself as ODF plus or a ODF plus community. And after that the community declares itself, there is a provision, the second level, where there is a verifying authority that goes in and verifies and then moves it forward to the state. And the third level is that the state uses a third party to go in and check if it is really what they had claimed it to be. And after this 3 layers of process works out, only then a community is certified as a ODF plus community, and the state declares it as the community which is ODF plus. So this is the process, and I would invite Sujoy to please share.
Yes, Shweta. So
sorry,
in addition to what Shweta,
excuse me, Sujoy. Yeah, just for sake of timekeeping, I think this is a theme that we are going to discuss more extensively in the second half. So please take good note of your answer, and now we move on to the third presentation. Because clearly open defecation monitoring and management, and it's a crucial point for not only for India but also for a lot of other countries. Thank you for this. I would move to the third speaker of today, which is Nicolas from Gather in Madagascar. So when everything is ready, the floor is yours.
Hello, everybody. My name is Nicolas Radanielina, and I can go by Nick. And thank you very much for attending this webinar. Gather is like our head office located in the UK, but I am based in Madagascar. So Gather, like for in a short, like giving you our goal is to improve toilets to everyone, and also to get those details data to everyone. Next slide, please. So today I will I will go through some of our vision, and I'll go through like what is the sanitation gap, and then we'll go through the COVID challenges. So like our vision is for every person, regardless of their age and ethnicity, gender, orientation, with economic status, or ability to have access to a safe working toilet. So meaning like we do not have any discrimination. And our mission is to close the sanitation data gap, which I will explain later. And we are in partner with 3 private NGO and the municipality of Antananarivo, which is the one that really need our work, which we will go through that later. So speaking of the sanitation data gap, what is it? Sanitation data gap refers to the missing data which does not exist within the municipality of Antananarivo, specifically within the 5th of arrondissement, and we are focusing on that, on quantifying, localizing, and to enhance the understand of those missing data. Next slide, please. Okay, so in order for us to meet our vision, mission, and close that gap, as a man mentioned previously, that we are partnershiping with the sewer, which is the municipality from the government, and the SMA is the sanitation company, which is semi-government. And then WhatsApp also is one of our partners, and the last one is Ruat. So we are online with the municipalities, governments, goal to have a safe and clean toilet by 2037 in Antananarivo. So our main our main issue here is to a lack of data and how those international resources capacity, like Leafy has mentioned in Kenya, that people have those a problem on those resources and capacity, and then our main goal is to build the sanitation data platform to upload the existing data, and those data does not have access to, because we have had 3 workshops with the government to meet those goals. We have been through the overview of sanitation in Natanari, and then we have the second workshop to standardize our data, and the last one, we have had built our platform, and we have demonstrated to the municipality and our partners. Next slide, please. Great. So our main challenge and disruption from COVID was, of course, the travel restrictions for our UK team. Like, they wanted to come to give the workshops and everything, but then the COVID came. There was a total lockdown and lots of corona stages in Tana. Then that led to the pausing our grant for 5 months, and we almost couldn't start our hub, so that delayed the opening of our hub. Next slide, please. Okay, so the changes we have made is like choosing and focusing on the local leadership championing, meaning like myself as a program manager, we are 2 more technical staff. We have recruited 2 child scientists who helped us to build our platform, which is now running really well. Then we collaborate with some municipalities and municipal sanitation companies, which those are like a private or non-profit organization, and then we were adapting those stairway of changes on hiring facilitator to facilitate the workshop with the presence of myself and the technical staff, and those are anchored by the UK team. Next slide, please. Okay, so this has a lot of impact to our local governments and decision makers. They have understand through the workshops the lack of value chain coordination, which was the because our main client was the municipality, which was a bit delayed on giving information or coordinating with the private NGOs. But now they understand on how that works, and that lack of coordination delays decision making and actions, which has been redeemed since the second workshops. Because the communication was a little bit shifted, related with the municipality office. So this had a great impact to the local government, because we couldn't meet because of lockdown and all of those restrictions. So those were really the main impact with the local government and ourselves. Next slide, please. Okay, so the key lessons, the key lessons that we have learned during the COVID is that we valued the local leadership, knowledge, and we have centered them into a really great approach, which we were using the agile approach to help us to meet our goals. Then we did a cross-sector partnership and collaboration with the local NGOs. Okay, thank you very much. And that is the end of my presentation.
Excellent, excellent. Thank you very much. Thank you very much, Nicola or Nick, for the presentation. It was very interesting. Same as the other time. Let's see what questions are in. Yeah, there is a question that would also be my question. And I'm going to ask you. It is a question from the Q&A box, which is about you mentioned your theory of change, and you mentioned that Gather changed their theory of change to respond to this new ways of working. Can you please tell us a bit more about that? Thank you.
Great. The theory of changes is that we have approached, because we were before in advance, we were going to stop to work with the municipality. However, because it was difficult to restart with them, because COVID restriction, we couldn't move to go to the office. So we moved to theory that that is giving us like an open centering the local leadership and pursue to the cross partnership. So those expertise exists outside of our sanitation sector that could accelerate the local national goals. Meaning, like, we do have connection with the government mapping company, and then we also we also pivot and adapt our develop methodology depending on how the partners are approaching um, with the municipality government, because they also do have a hard time to communicate between themselves. Do I answer your question?
I think so, at least for now, but maybe something that we can discuss more in full in the second part is when we think of a theory of change, my thinking would be what kind of not only the change in the approach, but also if there are new factors or new I would say result chains that have emerged during this period. So this is something that is a big question, I believe. So once again, let's put it in the parking lot, because it would be great to discuss this with all the panelists. Let's see if there are more questions now for Gada in the chat box. Let's see. There is a question that I can ask you quickly about, you mentioned the municipality's long-term objectives in sanitation, which are for 2037, I believe. So the question, and maybe you can reply quickly to this one, is whether the municipality also has some short-term objectives, for instance, yearly or annual objectives, and how this changed during the pandemic period.
Okay, thank you very much, Jayan. Yes, of course. Let me go back a little bit and like explaining to you. The mayor was elected in 2019, which he will lead for 5 years. That meaning that he have his short-term goal for 3 years. For his Grantana mean like the big Tana, like a citywide project. So that his short-term was to reduce the sanitation, the emergency facilities, which he has worked really hard with one of our partner, LUAT and the SMA. So that has like an impact in COVID, because that has been stopped. You know, those equipment that he has like trying to import it here in country, they didn't come because there was some equipment that he wants to be in the countries during those COVID big time, but they didn't come because the port was closed and the border was also closed. So that impacted his short time goal. So now we are starting to pick up again.
Thank you. Thank you very much for this. Yeah, I think we had 3 great presentations, and we are starting the general debate right now in a second. I took good note of a lot of recurring themes and questions that emerged from the participants and the attendees, and also some recurring themes from the presentations, which is all great. Before we move to the second part of the webinar, I would ask my colleague Teixeira to launch the second poll of the day. And we can keep it open for a minute. This poll is a bit more, once again, about you. So The first question asks whether your ways of working have changed during the COVID-19 pandemic, and to what extent that happened. Well, the second question that you can find if you scroll down in the poll box that opens in your screen is whether the kind of things that we have been discussing so far resonate with your own experience of the pandemic. Your own experience as an individual, as a person, but also as a sanitation practitioner or a development actor in your professional roles. So we see that some of the results are coming in, more answers are coming in. So let's keep it let's keep it open for some more seconds. In the meantime, that we have maybe a cup of water. Let's see. Okay. Some results are coming in. Let's give it another 10 seconds. Okay, I think, Shira, now we can end the poll and share the results with everybody. All right, what we see here is that the pandemic has affected very much our ways of working. We can see that the vast majority of the participants, of the respondents, said that changed that very much. And someone else said somewhat, but the majority, I think, is clearly on the very much side of the spectrum. The second question, which is about the current debate, I think it's 50-50. So about half of the respondents say that this debate is relevant and resonates with their own experience. The other half says that the debate is somewhat in line and somewhat resonates with their own experience of the pandemic, which is interesting because that helps us to shape the second part of the session. So I would say that we can stop sharing these results for now, and we can start with the second part. In this part of the debate, all participants are very welcome to keep posting questions in the Q&A box, which I will consolidate, and I will do my best to dispatch to the various speakers and panelists. And please let us know if any specific questions are for any specific panelists. So let me start from something that emerged from the presentations and from the questions before. There were some of the speakers mentioned digital solutions that were triggered by the pandemic and by the limitations that were linked to it. So I think it was a question for everybody. So I would invite the three organizations who are here to answer and tell us a bit more about the use of digital technology and to what extent the pandemic increased the use of digital technology in your sanitation activities. Maybe we can start with the Sanivation.
Yeah, thanks again. I think the use of technology, especially with working with the utilities, initially they wanted to reduce the physical customer engagement because that was posing a risk of transmission on COVID. So a couple of the things that they were able to do, like Kisumu Water, they established a call center where any customer with any complaints or any follow-ups, they could be able to call to that one number and report any of their complaints. And I think something else that they introduced was on payment of services. Initially, there was a lot of cash transaction where customer will come physically to the utility and make their payments. And so they introduced mobile payment app that they could pay. And of course, also for their billing, they could also send this in a soft copy manner as opposed to initially they could come and pick this up from the utility. So yeah, these are some of the things that they introduced. And one last aspect is on communication about COVID. And marketing of the utility services. So they used a lot of local radios, a lot of SMSs to customers to keep them up to date on new approaches of their services and awareness on COVID. Yeah, pandemic.
Thank you.
Yeah.
Thank you. Oh, sorry.
Yeah, no, just to add to what FD said, just even the way of doing business changed, right? People became more virtual, and even like the utility staff and people who were working on these projects. So I think it was more acceptable post the pandemic to have these virtual meetings and not really have to, earlier it was more in-person based, and now I think the trend is going towards more virtual meetings and virtual based.
Thank you so much. I would ask this same question, but in a slightly different way, to our friends from UNICEF in India. Just to ask, you work very closely and provide support to the PRIs for sanitation. Were you able to introduce digital communication systems with them? Were they able to take that on board? Were there any limitations to that?
So you are taking that or I'm taking that?
No, you go first.
Okay. So in the initial stages when we did orientations or training, for instance, and these you have to understand that this is like deeply rural areas where these PRIs are there. So the thing was it needed a smartphone. And so if there was one smartphone in with one particular frontline worker or a PRI member, then 5 or 6 others could then go on to that phone and take the training. But as we proceeded over the years from June to say December and now, we find that more and more of them are using Zoom as well as MS Team Windows, for example, on their phones, and are quite conversant with the way they even start engaging or asking questions. And the other thing that UNICEF tried and engaged for higher reach in using digital communication was using young people as partners in this because they could then reach out through these communication mechanisms to their decision makers and other frontline workers. Over to Sujoy.
Yeah, one point only I'll add. Just to give the participants an idea of what we are talking about, India has around 400,000 sanitation frontline workers. So to reach out to them quickly with proper messaging on COVID was extremely essential. So in addition to Zoom and Teams, I think first of all, the role of WhatsApp was very critical. WhatsApp has been a major contributed to India's sanitation programs kind of communication method, and preparing short films using GIFs, using messaging to quickly spread the message of water sanitation and hygiene, and also to collect information about what is functioning. I know in the state of Uttar Pradesh, where there were large number of hand pumps that had broken down during the COVID kind of lockdown, and yeah, WhatsApp was used extensively to collect information about that and galvanize workers in protective and protected people who could go and get the hand pumps repaired. So there we have seen a significant use of technology. Yeah, over.
Thank you. Thank you for this. This is very interesting. And what I'm doing now, of course, I haven't forgotten about Nicola in Madagascar, but I would like to pivot a little bit because when you hear about the use of digital technologies to reach out to the people, to local authorities, governments, sanitation providers, there may be an issue of sometimes of access, and so an issue of equality, which is a big, I would say, overarching problem in sanitation. So the question that I would ask once again to the three organizations, this time starting with Gather in Madagascar and with Nicola, my question would be about equality and the principle of leave no one behind. For instance, access to technology can represent a divide where some people have access and some people are left behind, and this can add up to inequalities that existed before the pandemic and can make it more complicated to manage in some context or in other contexts. But there are so many other dimensions. There is the gender dimension, and the colleagues from India mentioned the third gender a few minutes ago. There's the gender dimension, there's the social dimension, the wealth and poverty dimension, the rural-urban divide. So my question for the three speakers would be, tell us about any kind of dynamics in inclusion or exclusion, equality or inequality that you have observed during the COVID-19 pandemic in sanitation. And if we can do this a bit concisely, because we are running short of time. Can Nicola please start?
Okay. Thank you for your question. Yes, there was in terms of equity and equality before COVID-19, like we had like difficulties like for people to use technologies, because people do not get of technologies before COVID-19, because they didn't expect that there will be like working from home type of things, and now like when COVID came, everyone is rushing like on learning the new technologies to access data, like buying like smartphones, like doing sacrifice to buy smartphone to do the work and checking data on social medias and on the internet. So this also affects the costs of the internet costs here in Madagascar. Here, like before or after the COVID, I think like in terms of gender, there is no really differences like within the country are related to like sanitation or any type of things. But like like some people doing like a public like doing like a public toilets when they do not see facilities, they do it like sometimes hiding like in the trees or like in some people's fences. So male male is being seen as acceptable rather than woman is doing it like when woman doing the public toilet or in a trees, that is not acceptable. So that is a bit of like discrimination in country before or even after COVID.
Thank you. Thank you. Thank you, Nicola. Maybe Effie or Nandita, can you tell us a bit more about equality or lack of equality during COVID in your experience in sanitation?
Yeah, Nandita, take that.
Sorry, can you hear me? I'm cutting out a bit. So.
Sure.
Hello, can you hear me? Yeah.
I can hear you.
Okay, perfect. Sorry, I've had a bit of internet trouble. Equality and equity. Yeah, very good questions. I think those existed even before the pandemic, especially in the sector. But in terms of equality, I think a lot of it is information, especially when it comes to delivering services. And if you mentioned this already, a lot of it is having access to technology. And so a lot of people were left behind who didn't have access to this technology and who didn't know what was happening, for example. So we saw a bit of shift there. The other thing, and I think someone had brought this up, was shared sanitation facilities and the use of shared sanitation facilities. And this is a major point of equality in terms of access. And we saw that informal settlements were largely hit, even especially where shared sanitation facilities, hand washing stations were a common point of contact. And so there was no, it was a luxury to isolate, right? And so there was, wherever there was dense settlements, it was not possible to isolate. So in terms of that, we saw a big issue. How we resolved it is a lot of increased messaging, at least from our side and with the help of utility. But again, there were definitely dynamics that were beyond capacity. And a part of the reason we are pushing for some of these emergency plans is when the next one hits, we are not preparing for it and implementing it. So yeah, and in terms of gender, maybe, I don't know if you had it to, if you wanted to add something on that. But personally, I don't have a big change in that in terms of what we saw on ground.
Okay, thank you so much. Now, yeah, just we are already running out of time. It's always hard to stick to schedule. I wonder if Shweta or Sujoy, you have a 30-second consideration about equality under sanitation in COVID-19, based on your experience.
Yeah, Shweta, you want to take that?
You go ahead.
Okay, so what I'll just want to point out is what Shweta already mentioned in her presentation about there is now a focus of, so India has a large scale, what we are calling LNOB campaign, a leave no one behind. So even though we have had a very successful sanitation program in India, there is still a percentage up to 5% of the households who don't have household toilets. So the priority of government is to make sure that they have household toilets or they have access to a shared facility. I can understand the concern about shared facilities, especially in COVID times. This was also created quite a lot of, what should I say, panic is not the correct word. It's got a lot of concern in India with increasing community sanitary complexes. So that is an issue, but providing access is a priority. One quick point I'd want to mention, which Shweta said, was to look at people who are deprived, the handicapped people, the people from the third gender, the people from who have remotely located tribal villages. The focus is to make sure that the government and the Panchayat Raj PRIs can provide services to them. So we are trying to build capacities, working with government, working on technology, low cost fabrication of facilities, making sure that both water and sanitation services are provided. I saw a couple of questions. I'll say one thing. India has put in plenty of financial support.
I'm
sorry.
one of the advances. Yeah. I'm very sorry. There are so many questions that we haven't been able to answer directly. We can see how to manage this in the next webinar or in the meantime. So yeah, thank you, Sujoy, for your contribution. And I'm sorry if I need to cut you off a little bit. I'm just time aware. I think John Peter had like a very short contribution about equality. I don't know if you're able to say that in like 30 seconds.
Yeah, of course. Thanks, Jan. Just to add, so obviously Gather's work is very focused on the data side as opposed to delivering services. And I think we've definitely, through the pandemic, seen that a lot of data is collected locally and a lot more than is perhaps reported internationally. But the real challenge comes from having the mechanisms for that data to be standardized and shared. I think we found that a lot of municipalities, about 10% have access to the tools and software that they need. And so that presents a real problem in really being able to allow the local municipality to take full leadership in accessing the data and then analyzing it to be able to inform their evidence-based decisions. So that's certainly something that I think needs to be looked at on a more global scale going forward, as how do we make sure that local decision makers can access the data that's been collected about their locations and their populations.
All right, thank you. And thanks everybody, really. It's already, we are already 4 minutes after our expected end time. It's great to see that most of the participants are still with us. I'm taking just a couple of minutes to recap some of the great points that have emerged during the questions and answers and the presentations. I think there was a lot of interest about theories of change and how theories of change can evolve in a situation like the COVID-19 pandemic. But also there were mentions of finance, ability to pay, and the value chain for service provision. Something that emerged and we were not able to explore in full was monitoring ODF and monitoring sanitation outcomes. Also, there were questions about shared sanitation and to what extent investing in shared sanitation solutions makes sense in these circumstances. And also something that emerged in, I think, the 3 presentations and in some of the questions was health and safety for sanitation workers, which is also important. And the aspects that we have tried to delve into a little bit in the second part were the digitalization, which raised a lot of questions in the first part of the webinar, and how this links with equality, and if there were any new equality or exclusion dynamics that emerged during the pandemic. This was a great webinar, and I say thanks once again to the speakers and panelists who have provided quality to our conversations. I am reminding you that the second appointment will be on 31st of August at the same time of the day. We are going to talk about sanitation, hygiene, and the new normal. So it's a kind of natural continuation of this session. We are going to have the London School of Hygiene and Tropical Medicine, UNICEF from Mozambique, One Drop from Guatemala and Canada, and PSI from India. I would also like to say thank you to UNICEF for the support in this initiative. And I am reminding you that as soon as this session is over, there will be a survey that appears on your web browsers. And please take a couple of minutes to fill it, because that's very valuable feedback for us to inform our next web online events. So thank you, everybody. I hope this was interesting and fruitful, and I hope this kind of reflections can help everybody to do our respective work as people who work in sanitation in different capacities, practitioners, researchers, funders. Thank you very much again, and I hope that I will see you all on August 31st. Thank you very much.